Today, more than ever, with the daily impact of what we subject our bodies to and the toll it takes, pain is becoming a more common part of our everyday lives. But it doesn't have to be. Many types of nerve-related pain can be reduced or even eliminated. With us today is Dr. Christopher Maloney, a Harvard-trained surgeon, associate clinical professor of plastic surgery and neurosurgery at University Medical Center in Southern Arizona, and founder of the Maloney Nerve Institute. Dr. Maloney, tell us about the Maloney Nerve Institute.
The Nerve Institute was founded in 2002 to try and help people that have difficult peripheral nerve and nerve pain-related problems that can be treated surgically. And since that time, we've treated over 1,000 patients that have had chronic pain and nerve injuries that can be helped surgically. Back in 2002, the Nerve Institute was started in Southern Arizona to try to provide help to some of the diabetic patients in the population in Southern Arizona. There are a lot of different microsurgical techniques and research projects that the Nerve Institute works on an ongoing basis to try and help these patients with their difficult peripheral nerve problems. There are also a lot of different areas of the body that we treat. The legs, the lower abdomen and groin, knee pain, shoulder pain, ankle pain. Those are just a few of the difficult areas that we have a focus of interest on.
There are several types of nerve-related pain. For example, groin pain. What can cause groin pain? And what can you do to help?
Groin pain is an area of the body in the lower abdomen that oftentimes causes a lot of pain in patients. It's usually caused by post-surgical types of pain, such as people that have had hernia repairs, C-sections, or other lower abdominal types of operations. And there are many nerves in this area of the body that can be injured during the normal course of surgery or routine trauma. And oftentimes we see these patients many years after the nerves have been damaged and they've been seen by multiple physicians. So our goal is to identify these patients that have pain in this area, identify that it's actually a nerve causing the problem and not another unrelated medical problem. And then we perform special diagnostic blocks to identify if the patient may or may not be a surgical candidate. And that way, what these diagnostic blocks help us do is identify which pain syndrome or which patient is having pain due to a nerve problem. And the procedure is actually very straightforward. After the diagnostic block, we perform an outpatient surgical procedure that typically takes less than an hour. And we identify these small cutaneous nerves that are only sensory in their function. And these nerves are identified and removed, and any other underlying scar tissue or untreated medical conditions are treated. And we have a very high success rate in the right surgical patient for treating this problem.
Let's hear from one of Dr. Maloney's patients.
Well, I'm a swimmer, and I swim about 100 to 150 miles a year and have ever since I moved to Tucson about 8 years ago. And in the fall of 2008, I pulled something while swimming. I didn't know exactly what it was, but I knew it hurt. And I stopped swimming. And about 3 days later, because I'm so addicted to swimming, it's such a wonderful exercise, I went back and I think I re-injured the injury. So it compounded itself. And I went to my doctor, and my doctor said, Tom, I think you have what could be a hernia. I want to send you to a general surgeon who's a very good person. And within a minute, he said, Tom, you don't have a hernia. He said, I can't do anything for you. I would recommend that you see a urologist. Since it's in that area of the body, I think they can help you. She palpated the area. She tried to help me. And the one thing that she did do is she gave me like a cocktail injection of lidocaine, marcaine, and Kenalog, which relaxed that area, and it felt wonderful for a period of a few hours. But then the pain returned. And she wasn't going to do any surgery. She thought it might have to do with spermatic cord or whatever, and she just didn't feel comfortable doing that surgery. So then she set me off on a course of pain management, where I went for physical therapy once a week for 8 weeks. And once again, these are caring people, well-meaning people, but it was not the answer. I mean, and all that time, so you lose all that time and still no one is solving your core problem. And then they set me over for pain management, and they set me off on a series of medicines, one of which almost drove me crazy was called baclofen, and that was not the answer. And then finally, as a court of last resort, they said, well, we've had some success with Dr. Maloney, Dr. Christopher Maloney. And I said, maybe you could, would set up an appointment with him and try and talk to him. Well, to the website, and the website was phenomenal. And that particular area of the website on the groin, it really spoke to my problem. And I thought, maybe this person can help me.
I developed a problem with pain in my leg. If I walked any distance at all, I'm talking 25, 35 yards, I had to get back to the house and get an ice pack on it. I had 7 or 8 ice packs, and I'd put ice pack here, one here, and the pain would go away pretty sudden, like in a half hour, and I'm fine. And as long as I didn't get up and walk, I'm okay.
Our life was going from one place to the next with a ice pack in a cooler. And every time we got out of the car and got into where we were going, he'd put an ice pack on his leg and he'd sit there for 20 minutes and then the pain was
basically, I could have qualified for a handicap sticker, and I was that bad off because I couldn't walk from the middle of a Walmart parking lot or anywhere else.
Well, let's fast forward now to the day of surgery a little bit. Tell us a little bit about your experience during surgery, after surgery, how the whole procedure was.
I basically walked out of here. It was sore. 2 days after surgery, I jumped in my truck and headed for Kansas, which is a 1,100-mile drive with my trailer behind me. And so we went to Kansas, and back there we got where a couple of weeks after the surgery, we went out to my daughter's and did a little dancing. Nothing real hard, but enough that it didn't hurt.
Dances.
Yeah, it didn't hurt to dance after that.
And tell us how you are now. How's your level of pain and how's your level of activity compared to how it was?
I'm back to 100%. I've got a treadmill, I've got a weight machine, a Bowflex that I work on, a treadmill. I'm looking forward to getting back to Texas so we can go beachcombing.
And what would you tell any patients that might be interested in this type of procedure about your whole experience?
Don't wait.
Hey, don't wait.
That's the main thing. Do not wait. I see these people, and I'm older. I'm 72 years old. But I see these guys that are 65 and they got bad this, bad that. They hurt, and they won't go into a doctor because they're afraid it's going to hurt. Well, it's already hurting. So get it done and get on with your life and enjoy your life. If they got a nerve block or something, something's happened to their nerve, they need to get it taken care of because it's no big deal. It's a blip in the road. And I would like to thank you for getting rid of this pain because it gives me back my life. Okay.
Thank you.
Thank you very much. We really appreciate it.
You're welcome.
I had a surgery in 2002 and it went terribly wrong.
And this is in your abdominal area?
My abdominal area, partial hysterectomy. And they nicked a vessel and didn't know it, and I bled out. And so after they stabilized me, I spent about 10 days in the hospital and was septic, and they had to do 2 more surgeries. And involved in those surgeries was a total of 5 drains that were very long and in for a very long time. And so once everything was pulled out and they said, you're fine, I was left with this pain in my abdomen, and I thought it would go away. And after about 6 months, it didn't go away, it got worse. And so I would follow up with the surgeons and my physicians, and everyone just prescribed more medications. And after about a year, I was taking almost 18 prescriptions. Yeah. It was in my right abdomen below the belly button, but not quite where your appendix is. So it was mid-abdomen below the belly button. And it was there all the time. And then whenever I would try to run, exercise, work out, or do any type of twisting or lifting movement, it was like a sharp pain, like someone stuck a knife in my belly. I, of course, saw the 3 surgeons that were involved in the surgeries. I went back to my primary care doctor, and they referred me to a physical therapist who helped. some. She was a female physical therapist and worked on just being able to stretch all the scar tissue that was left in the abdomen. And then I was finally referred to a chronic pain physician, and they worked on prescriptions. And at one point, because of this prescriptions that I was taking, they were going to medically disable me, so I wasn't going to be able to work because I was on narcotics and all kinds of medications, and I just said I don't want to live like that. So the chronic pain specialist worked for a regimen over a year and a half, and I finally got off all the medicines and just accepted that I would live with a certain amount of pain.
When you first met me, one of the things we did was a diagnostic block, which is where we take some numbing medicine and we inject it in the area where these nerves commonly live. And do you remember what that was like?
It was like having any area kind of numbed initially with when you did the procedure, but you told me to take off and go do whatever I wanted to do that was painful in the past, and so my husband and I did. We went to the gym, and we went and played tennis, and we went for a hike, and there was nothing. There was no pain.
So during that 6 hours during the block,
it felt like I felt before 2002. The surgery was simple. We pre-scheduled it so we could plan for it. And as soon as I came out of the operating room and the recovery room, I knew that something was different. I knew that there wasn't any pain, because there wasn't. It was gone. It was just, I'm not even sure I can describe how that feels. And especially because you don't realize how much pain you're in when you've lived with it for such a long period of time. You just kind of get used to it. I think it took a little while to trust the feeling of having the nerve gone, because it's a little numb in that area. But now we bought a boat, and I water ski, and I play tennis with my family, and I go to the gym. I've lost 10 pounds in 3 pant sizes. It's just a phenomenal feeling to not have pain, and to realize that you had this level of pain prior to a surgery. I wish I'd have known earlier. I wish any of the 6 physicians that I went to in Tucson would have said, hey, why don't you go see Dr. Maloney? Because nobody did. They just wanted to give me prescription after prescription and tell me that it's a side effect and there's nothing we can do, and you have to decide whether or not you want to live with it. I don't have to live with it. It's gone.
this is a representative example of some of the hundreds of patients with groin pain that we've successfully treated here in southern Arizona. Lots of patients, whether it's due to surgery, trauma, or a sports-related injury, can end up with groin pain, much like the patient that you've just witnessed. These patients are identified and appropriately screened to determine if they're surgical candidates. And those patients that we can treat, we have a very high success rate of helping them restore a busy and functional life that they previously had before the injury.
I mean, in a larger sense, you sort of feel like you get your life back. You had to put your life on hold, and then you suddenly get your life back, and that's worth, I don't know, as a commercial would say, it's priceless. But I feel complete again, and I think I'm probably more appreciative because I went through this. I think that you can hear other people's stories, and yes, you can gain from them. But if you are living it and then you see this dramatic turnaround where you really were almost at a loss for hope, that's pretty meaningful to people. I mean, if that doesn't get your attention, probably nothing will.
Today, more than ever, with the daily impact of what we subject our bodies to and the toll it takes, pain is becoming a more common part of our everyday lives. But it doesn't have to be. With breakthroughs in modern medicine and the emergence of new technologies, doctors are making great strides in finding more ways to provide relief from pain. Many types of nerve-related pain can be reduced or even eliminated. There's no need to live in constant pain. Call or email the Maloney Nerve Institute today and get started down the road to a pain-free life.